Have you ever noticed that grief doesn't just affect your emotions, but your body too? Do you find yourself feeling unusually tired or experiencing aches and pains or struggling with changes in your appetite? If so, this video will help you. We're going to go over common physical symptoms that people experience after loss, why these physical symptoms happen, and how you can manage them overall. Grief isn't just something that we feel emotionally. It affects our entire body, from physical aches and pains to fatigue to even changes in our appetite. Grief can manifest in ways that we might not really expect. Physical problems during grief occur because grief is a profound emotional experience that triggers a stress response in the body. That stress response is often known as the fight or flight response. And this can lead to release of stress hormones like cortisol and adrenaline, and that causes physical symptoms. When we experience this, sometimes we're feeling overwhelmed because we don't understand that this is also part of our grieving process. So let's take a look at some of the physical symptoms of grief that many people experience after a loss. Most people experience somatic symptoms. That is where we're feeling it in our body. And the intense emotions of grief, like sadness, anxiety, anger, that can manifest in our body physically. And the term somatic symptoms is what they're talking about. So, what are some of those ways that we feel it in our body? Just in general, aches and pains. We might feel physical pain in our body, like muscle aches. We might complain of headaches or joint pain. That's very common. And that may be due to the body's response to stress and tension. Fatigue and low energy is one of the things that a lot of people will talk about and will experience. Grieving can be exhausting, and it leads to feelings of that constant tiredness and low energy levels and just feeling like your body is being weighed down. We also experience sleep disturbances. Many people will say that they are having trouble with falling asleep, staying asleep. They notice changes in their sleeping patterns. And maybe they're sleeping way longer than before, or they can't sleep at all. And this is very common for a lot of people. Some people might even experience frequent nightmares after a loss. When this happens, it can result in fatigue, difficulty concentrating, and also can weaken our immune system. Grief can also affect our appetite. So we might have changes in our appetite. We may notice that we are eating a lot more or eating a lot less than before. And some people use eating, or I should say, eating becomes a coping mechanism for some people, and it may result in weight gain. Or if you're not eating, you might have significant weight loss. And with our appetite changing, these changes can affect our energy levels, and as I said, our weight and our overall health. Another physical symptom that people might experience is chest pain, or feeling like their heart is racing, or tightness in their chest. It can often be mistaken for heart problems. A lot of times, people end up at the ER because they are thinking maybe I'm having a heart attack, but it is often related to stress and anxiety. Shortness of breath is another one that people may experience after grief. They might feel like they just can't catch their breath, or they might feel like they are hyperventilating, or feeling like they're suffocating, or like their throat is closing. I hear that a lot. Increase in our heart rate, our heart palpitations. That alone can increase our anxiety and can heighten our levels of stress. Grief can lead to fluctuation in our blood pressure, either too high or too low, especially for feeling stressed. That will have our blood pressure changing. Grief can also cause stomach problems. such as nausea, feeling upset, constipation, or diarrhea. A lot of people don't connect that. I know for myself, I feel everything in my stomach. So that's a big one. And a lot of times people, like I said, are not connecting that, a lot of these symptoms, but especially the digestive symptoms, could be related to their grief. The emotional strain of grief sometimes can also cause physical feelings of lightheadedness or dizziness. And they are just some of the somatic physical symptoms that people commonly experience after a loss. Chronic stress and emotional strain can weaken our immune system. That means that it can make one more susceptible to getting sick and illnesses and infection. The body also is often slower to recover from them as well. And I emphasize this in counseling a lot of times when working with people who are stressed, but especially with people who are grieving, is that to take care of their body and to make sure that they are taking care of their stress levels, because they are more susceptible to getting sick. And that becomes very common for people, and they don't recognize, like, I keep getting a cold, or I keep getting like this next infection that's kind of going around. And just as your body's immune system is weakened, so it's important to understand that that can be related to grief. Another common reaction that people have is difficulty concentrating, having memory problems, a general sense of what I call grief fog. It's like that mental fog, and just feeling like your brain is just like pushing through like mush or something. As your brain is trying to process this grief, that it can feel these symptoms. It's important to understand that these physical symptoms that I just reviewed are a natural part of the grieving process. Normalizing these symptoms can help individuals take steps to take better care of their bodies, and to help them understand and realize, okay, I'm not going crazy, and I'm not alone in this, and give you a better understanding of what is actually happening. I think it's really important to emphasize that if you are having some severe physical symptoms, or they persist and they seem more intense than normal, it's really important that you consult with your primary care physician or a healthcare professional, so that we can rule out any underlying conditions. I know for myself, and when people come into my practice for anything, depression, anxiety, I a lot of times will want to know when the last time they had a physical, because I want to rule out all kinds of other underlying conditions that could be going on. So please seek out medical care if these symptoms are intense, or you think, okay, they seem different, or they're really intense and persistent. One of the things to help you during grief, and that a lot of people have a hard time with, is self-care. And I have a video that you could watch on some tips on how to better take care of yourself when you are grieving. But practicing self-care, like getting regular exercise, a balanced diet, getting rest, that can really help you out and help reduce some of the symptoms that you're having. If you want to go a little deeper, check out the video up here in the link, and you'll be able to get a few more tips on how to better manage it. Managing your stress, like whether it's deep breathing, like I said, exercise, meditation, just yoga, that's going to be important. Staying hydrated. I tell people that a lot, and they're like, what? But that really, drinking plenty of water can help manage some of these physical symptoms, lightheadedness, and some other ones. Staying connected to others, trying to have a social connection, and seeking out support from loved ones or counselors or support groups also is really beneficial in the grieving process. When you're able to recognize and address these physical manifestations that grief can cause, it can help in the overall healing process. If you've experienced any of these physical symptoms while you're grieving, or if you notice them, definitely share with me in the comments what you've experienced, what maybe surprised you in these physical symptoms. I know I said earlier my stomach was one of them, but another one was that heartache. I was absolutely blown away with how it really did feel like such pain and like a hole was in my heart. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more insights on coping with loss and finding resilience